deal with the challenge of depression and also help us to try to reduce the incidence of suicide in our community. It's surprising to know that the state of Colorado has the highest incidence of adolescent depression of any state in the country. We're the #1 state for adolescent depression. Maybe our panelists have insight as to why that's the case. No one's really sure, but it's certainly a concern and a reason why we really have to be vigilant about this issue. In addition, nationally, the third leading cause of death for adolescents is suicide. And disturbingly, in the state of Colorado, it's the #2 reason. And so I'm really glad to have a great panel with us tonight to talk more about this important subject. I want to start by thanking our partners, the Boulder Valley School District and the Boulder Valley Media Alliance and Channel 22. Without their collaboration, this ongoing series would not be possible. We'll also be talking a little bit later on in our program about information that you can use in terms of being more educated about what you need to look for in your children, in friends and family, yourself, to try to recognize whether there are some signs of depression that need further resources. And we'll be talking about that as well, the resources that are available in our community. And so I hope this is a very useful program for everyone. We have several wonderful panelists with us tonight, and I'd like to introduce them at this time. Our first panelist is Annie O'Donnell. Annie has been a member of Coleys Closet, which she'll help us to understand more about in a moment. It's a group of high school peer educators, and they've been working together for the past 4 years. During this time, Annie has served as co-president and has given nearly 100 presentations to classrooms and community groups about depression awareness and suicide prevention. She is also on the board of directors for the Second Wind Fund of Boulder County, which we're going to learn more about tonight as well. And currently, Annie is a senior at Fairview High School and enjoys working as a camp counselor during the summers. It's my pleasure to introduce Annie O'Donnell.
Thank you.
Hi, Annie. Thanks so much for being here tonight.
Thank you for having us.
I'm hoping that you could just spend a couple of minutes letting our audience know about Coleys Closet and the kind of work you guys do and maybe how it was formed.
Okay, so I'll start with the founding. Coleys Closet was founded in 2004 by a girl named Jenna Machado, who was a Fairview high school student at the time. And she started it after the death of her cousin, Coley, who committed suicide. And her whole family had felt that they maybe hadn't seen this coming, hadn't seen signs of depression or suicide in Jenna, and so they were very confused. And they were confused also of what they could have done if they had recognized the signs. And so she started it primarily to raise funds to help teens get therapy for suicidal ideation, but it then spurred a whole movement of trying to end the stigma behind talking about depression and suicide. And so how we do that is we go into middle schools and high schools, primarily health classrooms. And we also do some community presentations and presentations to support groups or other school clubs. And we talk with them for about an hour, usually, about everything from what they usually associate when they hear depression to what are warning signs, what they can do, and how to end stigmas behind depression and suicide. So that's...
And I know that your group does a great job of doing community presentations in classrooms in the Boulder Valley School District, but I'm guessing that you guys work in other districts, maybe private schools as well?
We do often. Most of our presentations are within BVSD. We have been to St. Vrain and surrounding school districts, but the majority are in BVSD.
And if a private school, for example, wanted to benefit from your presentation, would that be possible for them to?
Yeah, absolutely. I've presented to several support groups as well, as especially a big one in Boulder County and also up in Nederland and I believe down in Broomfield as well. So that's a lot of what we get as well as support groups for teens and middle schoolers.
And we'll be providing the contact information for these organizations at the end of our broadcast this evening. And if you miss that, you can always contact me at boulderpsychologicalservices.com, and I can provide you with that contact information as well. Well, I'm sure we'll hear more from you, Annie. Thanks so much for being here tonight.
Thank you.
Our next panelist is Dr. Peter Kleinman. Dr. Kleinman is a psychiatrist who is trained at the University of Colorado. and has a general adult and teen psychiatry and psychotherapy practice, previously in Ann Arbor, Michigan from 1975 to 2007, when he moved to Boulder with his family. He was also director of an outpatient behavioral health clinic at Chelsea Hospital during that time. Currently, Dr. Kleinman has a part-time outpatient practice in Boulder and enjoys doing psychotherapy as well as medical consultations. Welcome, Dr. Kleinman.
Nice being here.
Dr. Kleinman, I understand that you're involved with a couple of the groups that we're going to be talking about tonight. Maybe you could let us know about that and how you came to be involved with them.
Well, I've been involved a little bit with Hope, but mostly in my non-professional life with Second Wind Fund. I was asked to be on the board. I bring a professional orientation to the board that makes me a unique member, and serve on a therapy advisory committee which oversees the activities of our therapists, and Faye will talk about that a little bit. I also have a practice, so in a way these are two quite different roles, because although my professional life informs the way I think about suicide, I'm not really a professional when I'm working for the board. In my professional life, by the time a suicidal kid gets to my office, any number of other people usually have been involved, friends, family, counselors, you name it, because people get really frightened and concerned and step in when kids are in danger of hurting themselves. So psychiatrists typically are a bit down the line and are evaluating the question of safety, what needs to be done to ensure the safety of a kid. That's the primary concern. And then there are questions of diagnosis and intervention, which we can talk about later.
Yeah, I look forward to that. I appreciate you being here, Dr. Kleinman. Thanks for joining us. Our next panelist is Kathy Valentine. Kathy is a retired school counselor who now spends her time working with a number of Boulder-based nonprofits and other organizations. She's the chairperson of the Hope Coalition and also works with Second Wind and Coleys Closet. She also has a daughter who's a senior at Centaurus High School. And it's my pleasure to welcome Kathy Valentine.
Thank you, Jan.
Thanks for being here, Kathy. Help our audience learn a little bit more about the Hope Coalition.
Okay. The Hope Coalition was founded in 2005, and the reason it came about was because a number of organizations and agencies in Boulder County a lot of them were dealing with the issue of depression in all different ages, and decided that instead of duplicating services, we'd all come together from the Parent Engagement Network, from the Mental Health Center, from NAMI, from the CU, et cetera, come together and form a coalition, and we named it the Hope Coalition. And basically our mission is education. We have a few, obviously, missions. We are in existence to educate, engage, and empower the community about depression awareness and to save lives. Our core beliefs are it's okay to talk about depression. In fact, talking about it leads to action. And importantly, just as Annie said, we are striving to destigmatize depression, to make sure that people understand that by talking about it, it will lead to getting help. And what we do is we put on a number of events throughout the year. One is coming up, and we'll talk more about that perhaps in a few minutes, but on January 26th, there's a Hope event. The Hope event has been going on since probably 2003, and this is dedicated to families and youth, talking about depression awareness, suicide risks and factors, et cetera, what to do, what not to do, with speakers from the community talking about their journeys. Another event that we put on is the Gatekeepers event. This will be on March 1st this year. And this one is for any community member who would like to be trained in what to do, what not to do, if in their workplace, in their families, etc., they encounter someone who's depressed and they don't know what to do, or possibly suicidal. So we also do a candlelight vigil. We did this in September this year. This is in memory of those who have taken their lives by suicide. We will be doing this every year. So those are our 3 events, and they're basically there for education purposes. We always give resources for people who attend, to the people who attend, of what places to go in Boulder for help with this.
And my understanding, Kathy, is that the Hope Coalition is a 100% voluntary organization. Is that right? Grassroots organization?
Absolutely. It is only based, as far as it's only based here in Boulder, and it is definitely totally volunteer. We exist, I mean, I can say this because of a one-time grant that comes once a year. We do no fundraising, and we're lucky to have this one foundation who continues to support us to do the work that we do. Most everything we do is free for the public, is what I'm
And I
trying to say.
understand that a lot of the members of the Hope Coalition are folks who themselves have gone through this tremendous challenge in their
Absolutely.
lives.
We have a number of survivors, parents who have lost children, people who have lost other members of their family to suicide, yes.
And I would hope that being involved with the Hope Coalition helps them to feel a little less helpless. It has to be such an overwhelming experience, to have that happen in your family.
It's absolutely overwhelming. And I do believe that we're not set up to be a support group, but anyone is welcome to come to our meetings. Our meetings are the second Monday of every month. We meet at the First Congregational Church in Boulder. And if you will be getting information about how to be in touch with us through our website. If you have an interest in being part of it, you can come and go. There are no rules or regulations, but definitely we are looking for people who have an interest in promoting the education to the community on depression and suicide awareness. And no, you do not just have to be a survivor in order to be a member, but you're right, Jan, there are a number of us who have experienced suicide in our close lives.
And I understand, Kathy, at both events, I believe, the Hope Coalition always has volunteer mental health professionals available because this is a very challenging topic, and I think it can be overwhelming for some members of the audience. And I just think it's great. We have a lot of mental health providers in the community, and I think it's just great. I'm proud that, in my profession, there are folks that do provide that kind of support. And I'm assuming that if there are mental health professionals, licensed mental health professionals listening, and they want to get involved, maybe just coming to those events and providing that support, that they could get in touch with you as well.
Absolutely. Absolutely. We would welcome them, anyone.
Thank you, Kathy. Our 4th panelist is Faye Peterson. Faye is a licensed professional counselor and has practiced psychotherapy for over 26 years. Her practice focuses on working with families and individuals dealing with depression, addiction, suicide, financial and personal stress, aging parents, parent-child conflicts, and couples communication. Faye began her work as the executive director of the Second Wind Fund of Boulder County in April of 2009. She continues to be inspired by the many volunteers, community of supporters, and families that have supported Second Wind of Boulder. It's my pleasure to introduce Faye Peterson.
Hi.
Thanks for being here, Faye.
Thank you. Thank you for having us here.
Please tell us a little bit about the Second Wind Fund. I understand that the Second Wind Fund was around for a number of years in a different county. Maybe you can give us some background.
So Second Wind Fund of Boulder County is actually an affiliate of a larger group called Second Wind Fund, Inc. that began in Jefferson County, Green Mountain High School. They had, I believe, 4 high schoolers who committed suicide. Suicide is very contagious. And so when one person suicided, it cascaded. And so the community got very mobilized to try to figure out how to help the families, how to help the school deal with this issue. And so from that, Jeff LaMontagne, who is now the retired executive director of Second Wind Fund, Inc., he gathered the community, and it became a nonprofit, a very large nonprofit now. and is very successfully building affiliates throughout the state. There's, I think, 9 affiliates, and we are one of them. So we serve Boulder County, which goes all the way to almost Weld County. And then Weld County has an affiliate as well. So we started actually because, unfortunately, Compass House no longer was being able to serve the kids in Boulder County. And I was approached to be a volunteer executive director, which I was very happy to do. And then we very quickly got a grant, and then we really got moving fast. So we've been around since April 2009. We basically exist in Boulder County. Our mission is to decrease the incidence of suicide with our youth up to the age of 19, and by giving free counseling. And a lot of our kids come through the schools, through other nonprofits in the community. We actually just were able to start expanding into St. Vrain, so we're very excited about that. And so far, we have actually provided 59 youth with counseling. And I don't know if you want me to explain actually how it works now or later.
Yeah, please, let us know what
Okay.
the Second Wind Fund does.
So basically what happens is a youth is at risk. The school, somebody in the school pinpoints that child, maybe is seen by the school counselor, maybe the interventionist, and they call me, and I go through just a very brief overview of what's happening. And then they get a little referral slip from me that allows them to see one of our 15 providers. And most of our providers have at least 3 years of experience working with high-risk kids. And then they get free counseling for 8 sessions. If they need to, they can go up to, they'll have to have a brief consultation with me if it needs to go to 12. And if it goes to 12 to 20, we would do a sort of a report, try to get the kid to another service, because our services only go up to 20 sessions. So that's how it works. It's very easy for therapists. It's very easy for the school. Very little paperwork. And so all of our kids either are underinsured or uninsured. That's a very important part of that, because what's happening now with a lot of our families, they have insurance, but they maybe have a $50 copay, which is basically uninsured for a lot of our families. And some of our providers actually go to the schools, which is really terrific for our families, because some of them can't even afford the gas. So.
Yeah,
Thanks so much, Faye.
Let me just add one thing, because it gets confusing when we talk about our providers.
Right.
So the distinction is that we're not a clinic.
Right.
We're an organization that really is a cover and provides funding to support providers. But Second Wind itself is not a clinic, and we're not clinically responsible for the kids. And we provide funds to make it possible for therapists who are in the community to do this work, and that makes it a very unique and special thing.
Thank you, Peter.
To piggyback on both of these, the one also unique thing about Second Wind Fund is that it's immediate. When a parent or a student talks with Faye and they're given a referral number, they are contacted within 24 hours to 48 hours, and they are seen almost immediately. And that doesn't always happen with other facilities. So I just wanted to add that. It's a unique program.
Thank you. I also want to let the audience know that you could be a part of the conversation tonight, both our audience here, our live audience, as well as our audience watching at home. If you're here with us tonight, you have index cards. And please feel free to jot down a question for one or more of our panelists, and we will certainly try to get to all those questions. And if you're watching at home, you can submit your questions by visiting our website, boulderpsychologicalservices.com, and just click on the Submit Questions icon, and that will bring that question to us here, and we'll be asking the panelists. So please participate in this interactive event this evening. I also want to let you know, Kathy mentioned it earlier, but folks in the community have a great opportunity to attend one of the Hope Coalition events, their Hope event, as Kathy mentioned earlier, and it will be on Thursday, January 26th from 6:30 to 8:30 p.m. at the First Presbyterian Church, which is at 1820 15th Street in Boulder. And it's I've been to these events. It's a fantastic event. Even if you're not sure you need to be there, it's really helpful. It's really enlightening. And you might discover a lot of things that will be useful in the future, because this is a situation that when it happens in our lives, we don't anticipate it. And so whether you need it now or might need it later, it's a wonderful free event to participate in. So I would really encourage everyone watching tonight to go and join the Coalition at their next Hope event. We will be asking our panelists some questions that we'll be getting from the audience. But first, what I wanted to do is I wanted to talk a little bit about some of the warning signs of depression. And we have some slides that we're going to be showing that Lisa is going to help us with. Lisa?
I'm sorry.
So we're going to be looking at slide 1, which is the warning signs of depression. And these are, just so you know as we're getting the slide prepared, these are from the DSM, or Diagnostic Statistical Manual, which is the manual that we use in the mental health field to make various psychological, psychiatric diagnoses. And you can see from the slide, I'm going to go down the list with you. The first, and perhaps most obvious, is sad mood. However, for children and adolescents, we can also make the diagnosis if they simply have an irritable mood and they're not showing signs of sadness. And this is very important for parents to understand, because oftentimes when we see an angry teen, we just assume that they're angry and they need anger management help. And that's often the case, but more times than you might expect, the underlying issue is depression. And so we want to be very thoughtful about that. So we look for sad or irritable mood. The other key symptom, which is typically there when someone is experiencing clinical depression, is loss of interest in activities once enjoyed. And this is something else that you want to be very thoughtful about in terms of your child or your adolescent. If they start to lose interest in activities that they once enjoyed. It is also common to see changes in appetite or weight, either increased or decreased appetite, as well as difficulty sleeping or oversleeping. These are very common symptoms of depression. Sometimes we also see slow or agitated movement. Oftentimes, folks that are depressed report a feeling of loss of energy. Even though they slept, they still feel tired, they still have low energy. Oftentimes, we also see feelings of worthlessness or guilt. Difficulty concentrating. This is important because sometimes we misdiagnose kids with ADHD, for example, when actually there's underlying depression, because in both cases we see concentration difficulties, and that's why it's very important with a diagnosis of ADHD, for example, that we be very thoughtful about making that diagnosis accurately and rule out other things like depression. And then obviously if there are frequent thoughts of death or suicide, that would be another factor. And just so you know, to make the diagnosis, we really look to see at least 5 of these symptoms for at least a 2-week period, and we look for them to be occurring most of the day. So this wouldn't be someone that's sad for a short period of time and that's that. We would expect these symptoms to be happening for at least 2 weeks and to be happening most of the day. Thank you, Lisa. We have some questions that I'm going to ask our panelists to consider. And we're going to, a little later on, we're going to show you some additional information in terms of other things that you should be aware of regarding depression and suicidal concerns. But here's a question that we got for our panel tonight, and you guys let me know who feels comfortable answering it. How do I tell the difference between normal teen moodiness and depression? When should I be concerned? And I think this is a real challenge for parents, especially of adolescents, because what adolescent isn't moody? And so does that mean that all teenagers have bipolar disorder? I hope not. And so we have to be very careful and thoughtful about this. Anyone on our panel? I'm thinking Dr. Kleinman might have some thoughts on that.
Sometimes it's very hard to make that distinction. But kids who are moody as part of teenage rolling with teenage interpersonal problems, it tends not to last, and it tends not to result in plans for suicide. When it's hard to tell, I'll give an example of a moody teenager where I think action needed to be taken, but there was debate in the family about this. This kid who I met in my practice was a star athlete. He was doing extraordinarily well academically. No one would have thought he had a problem. He was involved in a lot of activities, a very energetic kid. He got into a disagreement with some friends, which happens, and it really affected him very deeply. So he put on Facebook a message for all the world to know that he planned to kill himself, that his life wasn't worth living. And then he drove his car out into a cornfield and sat there contemplating for a while. So I think everyone would agree that this sounds and feels like a real emergency and something needed to be done. And in fact, friends and family stepped in and got him to an emergency room. This is an extreme example of a kid reacting to interactions which displeased him. But it reached an extreme and something needed to be done. His life, for at least a period of time, was in danger. You get to a point where kids start giving messages out, and you have to take them seriously, whether they're fake messages or not. The family of this kid contended that he was just trying to play a joke on everybody. So there are some thoughts about the distinction, but this is a kid who could just as easily have killed himself as far as I'm concerned.
May I add to that? A lot of times we get questions such as, how do we know when to take people seriously in our presentations? And I think Peter brings up a great example by using Facebook, because a lot of times you'll see angsty statuses on Facebook, like, this is the worst day ever, and you think people are being overdramatic. And another sign we see is cutting or self-harm, that people a lot of times say, oh, that doesn't necessarily mean they're depressed or suicidal, which is true. But because these are signs that sometimes people write off as being for attention, it's important to know that perhaps attention is needed, whether it's depression or suicide or not. It's important to take any threats or signs that could be signs seriously. A big myth about suicide is that talking about it with somebody or asking if somebody's feeling okay or feeling depressed lately is not going to make them depressed or suicidal. And so it's important to talk about it if you're seeing any of these signs and you're not sure if it's depression or suicide or some other psychological issue. It's important to take it seriously.
Good point, Annie. And in fact, I think it's safe to say that the stigma about suicide is probably the biggest obstacle in any community in terms of dealing with this issue. Kathy, would you agree?
Absolutely. Not only talking about suicidal thoughts, but also just feeling depressed, that we somehow feel like we're supposed to take good care of ourselves around feeling bad, etc. But I wanted to address the question about how do you know the difference? And I can only tell you that a mom who did lose her 24-year-old son to suicide, when she speaks, she talks about the fact that if you as a parent get a gut feeling, don't hedge. And yes, it may feel, as parents, it's very difficult sometimes to look at our kids and look and see something that's scary. And we want to maybe not do anything about it because we want it to go away, or it's just a phase. But if it isn't, if it goes more than 2 weeks, as Jan said, and if there are a number of those warning signs that you see, don't hedge. Do something. Peter can perhaps talk a little bit about, either talk to your school counselor, and perhaps it could end up that Second Wind Fund can be a resource for you. If that is not the resource that you would go to, Peter can maybe address what will happen if you actually do call a helpline or if you call a therapist as to what will happen. But we would say, and we always do with the Hope Coalition, is don't hedge. Even if you call 911 and it pans out that it's not truly a suicide attempt, it may very easily have saved the life of a friend or your kid, etc. So that would be what we say.
And, it's important to keep in mind for our audience that when our kids have physical symptoms, of course we take them to the doctor to find out what's wrong. We should be thinking the same way about mental health issues as well. If our children have some of the symptoms that we're describing tonight or other symptoms that indicate some kind of issue around mental health, it's important to do the same thing and find a licensed mental health professional that can do an assessment. Any licensed mental health professional that works with children and adolescents is trained to do assessments to look at issues like depression, suicide risk, etc. Also, many of the professionals in your child's school, particularly in the public schools, like the interventionists, like the guidance counselors, have training in doing suicide assessments as well. There are a lot of resources out there for you, but it's important to let them know. Anything anyone wants to add to that?
I'll add just one thought, which supports what people are saying. The first issue is always what is safe. So that's true whether you're a mental health professional or whether you're a parent or just a friend on the playground. The first question is, you might ask, is it okay for this kid to be out of sight or to go home? And if you have a gut feeling, then you may need to take action right away, even though maybe 8 out of 10 of those kids will not end up committing suicide anyway. Just recognize that there may be 1 or 2 who would, and we don't know ahead of time which ones those are necessarily.
I'd add that it's important to report things because, as you talked about, licensed professionals who are trained to make diagnoses and screenings, even after reading these warning signs, we're not trained to make these diagnoses, or I'm not trained, I guess I should say, to make these diagnoses, but I can serve as the lifeline, and so that's what parents and community members and especially friends is what we talk to a lot of kids about. They're the lifeline. You're not the bottom line to make the diagnoses, whether it's suicide or depression going on, but you can be the lifeline if you get that gut feeling or see a bunch of the signs that are going on.
Here's a question that we just got in from someone in our community audience. What are the reasons that some teens engage in cutting or self-harm behavior? And what are effective ways to handle this situation and to help the teen? And you mentioned earlier, Annie, and a lot of people get confused about this in terms of whether cutting behavior is or is not suicidal behavior. And I think the answer is sometimes yes, sometimes no. But let's see what we can do with this question in terms of some of the reasons that teens engage in cutting or self-harm behavior.
Well, I will say something about it. I think that the general consensus is that cutting in itself usually is not suicidal behavior. Sometimes it can be, and sometimes that becomes the method of suicide, but most cutting tends not to be, and it's generally thought that the cutting is an expression of psychological pain, and because it causes physical pain, it often is a way of turning off the psychological pain or getting some relief from it. If the psychological pain is significant enough, the cutting may not be adequate for treating the symptom. In a sense, think about it as an attempt to treat an inner pain. And then those kids can become suicidal, and the treatment for it is to try to listen to the underlying pain. If you focus only on the cutting itself, you can do a great disservice to a kid. And
keep in mind, for most kids that cut, in my experience, there are 2 groups of kids that cut. One are kids that are exactly like what Dr. Kleinman just explained, and these are kids who really have very limited coping skills. And they've stumbled on this strategy, and it does help them in the short term to relieve some pain. But clearly we want them to have more effective, healthier coping skills than that. The second group are kids that are not necessarily like that, but they have a friend who has shared with them that they cut. And so a lot of times these other kids will try it to see, well, gee, maybe it'll help me. And oftentimes it is not the case. So there, too, really helpful to have a licensed mental health professional to help discern exactly what's going on. And any child that engages in cutting behavior clearly needs to be seen by a licensed mental health professional.
Let me just add, we also, the students who do the Coleys Closet also mention that it isn't just cutting, but it's self-harm. So it could be hitting your head all the time, or it could be burning, doing cigarette burning or match burning. I mean, it's self-harm. Cutting is something that we've heard a lot about in the media, I believe, but it could be other kinds of self-harm that people, that friends and parents may look at, see.
We have another question from our audience at home, and her question is as follows. How do you seek help for your youth in a way that doesn't cause them to shut down? As you can imagine, whether you're an adolescent or adult, the idea of going to counseling doesn't usually sound like the greatest idea. And particularly if you're a parent of an adolescent who's resistant to it, any thoughts on how we would help that kind of a family get their child the help they need?
I just had this happen a couple days ago, where a parent called me and said, my child is talking about harming themselves, but I can't get them to see somebody. So I'm always kind of taken aback by that, because I don't think you would have the same, like if your child had diabetes or had a seizure. I don't know if there would be the same hesitancy to get them to see somebody. So sometimes as a parent, you have to take them in, even if they don't want to go. So that always is interesting to me when parents struggle. And so one of the things I did do is I gave the parent some resources for her to see somebody so she could try to figure out why she couldn't talk to her child about what she was beginning to see. I sometimes as parents, we're very reluctant to actually say, I've actually had this incident where you have to say, do you think you're going to harm yourself? It's very hard as a parent to actually say that to your child, but sometimes just by saying that, your kid almost falls apart and says, yes, I am having those feelings, or no. And you as a parent should be able to sort of, I think parents are the best guides to seeking counseling for kids. They know if something's wrong. So
I like to use the example of bedtime. If bedtime is 9 o'clock, it really is non-negotiable, or should be. I mean, if kids say, oh, but I want to read, or I want to be on the computer a half hour, and you say, oh, well, 9:30 is okay, or 10 o'clock's okay, suddenly you've missed the point about being a parent. And that's just a tiny example. When it comes to a kid who has got major problems and is letting you know, sometimes it's difficult for parents to act, but some things are non-negotiable. It may mean we're going to see a counselor. This isn't, it doesn't matter what you feel at this moment, we're going. Because if you wait or talk about it, you may be allowing something dreadful to happen.
I'd like to come at it from more of a kid-teenager perspective of helping your friends. And this is an issue we get a lot of, what if my friend tells me not to say anything, and statements like that. So we always say, first, don't make that promise. You can tell them that you don't feel comfortable making that promise for their safety. And then Also, you can offer to go with them to see a counselor. You can seek out teachers, coaches, people in their church, or neighbors, or relatives, or then parents also. But there are all those other resources in your community to find a trusted adult that can help to sway their opinions about getting help or how to get help, where to get help. And I guess that could be a tool for parents to use as well, is maybe if that you know that they're really involved in church activities or in certain sports, or they really respect their uncle or something like that, just throwing out examples, that could be a good place to go to talk to them about maybe talking to your kid about getting further help as well.
The other thing to keep in mind, too, is a strategy that I think can be often effective is to mention to your child that you're not even sure that they need counseling. Mm-hmm. You want them to go one time.
Yeah.
To speak to a licensed mental health professional just to find out if they need help or not. That usually makes it a lot easier for the child or adolescent to go along, because they don't like the idea of just agreeing to perhaps years of counseling. And so just to get them in there for that first appointment, and if the licensed mental health professional is experienced with working with kids that are your child's age, with your child's issues, which you should ask them up front, they can take it from there. They'll be able to talk to your child in a way that your child will feel comfortable, respected, and empowered. Another question from our audience. My son smokes pot. He is lethargic and has little motivation and sleeps a lot. Is this depression or is this marijuana use? Does marijuana use cause depression? Before I have our panelists answer that question, I'm hoping that we could take a look at slide 3. Lisa. Slide 3. We're going to look at a slide in a moment, and it's going to tell us about some of the additional risk factors, and these are risk factors for suicide. Obviously, depression as well, but these are specific to suicide, and they kind of relate to this question about smoking marijuana. 3. We're getting there. Well, let's talk about this one. That's slide 2, but that's okay. Then we'll do slide 3. This slide that you see now talks about some of the additional warning signs of depression for adolescents and young adults. So let's go through them quickly while they're up on your screen. As we talked about, we want to be on the alert for any kind of increased irritability, anger, hostility. This is often a sign of underlying depression in adolescents, and it's worth repeating. Thank you, Lisa, because it's worth repeating, I feel. We also want to be thinking about their school performance. One of the things that we do see are frequent absences from school or poor school performance. They might also have a lack of interest in spending time with friends or family. This is a big indicator for adolescents, because usually spending time with friends, perhaps more than family, is very important. And when that gets reduced, we need to understand why. Talk or efforts to run away from home is another indicator, as well as social isolation, poor communication, extreme sensitivity to rejection or failure, reckless behavior, and also neglect of clothes and appearance. No one of these things is enough to make any diagnoses, but the more of these indicators that you see, the more concerned you should be. Let's look at the next slide. These are the risk factors around suicidal behavior. And the first one, and it should be first, is alcohol and drug abuse. And this is how it gets back to the question from our audience. Sometimes teens try alcohol or other drugs to relieve depression. They try to self-medicate with different substances. Unfortunately, a lot of these drugs, like marijuana and alcohol, actually have a depressant effect themselves, and they tend to lower inhibitions against self-injurious behavior. Over 90% of teens and young adults who are suicide victims have a mental disorder such as depression and/or a history of alcohol or drug abuse. So that's another big indicator of concern, alcohol and drug abuse. In addition, previous suicide attempts. Half of all teens who have made one attempt will make another, and approximately a third of teens and young adults who complete suicide have made previous suicidal attempts. In addition, we talked about the contagion effect of suicide. When there's suicide completions by friends, unfortunately, we have seen other kids kind of follow suit, and so we want to be especially alert when these unfortunate things happen at a school, for example. The other thing to be aware of is availability of a gun significantly increases the possibility of having a suicide in your home. Believe it or not, if you have a gun in your home, you are 5 times more likely to have a suicide in your house than homes without a gun. Clearly, if there are guns in your home, you need to be very sure that they're safely put away and that the children in your house have no possible access to them. The other thing that's important to know about is recent traumatic events. These can be a lot of different things. These could be victims of abuse. These can also be physical injury. Kathy and I both know a mom whose son was a football player at CU, and he unfortunately suffered a physical injury that stopped his ability to play football. And in hindsight, it was clear that this was a significant warning sign that the family just didn't realize, unfortunately, until it was too late. And so when we have any kind of recent traumatic event, this can trigger suicidal thinking and behavior. Unplanned pregnancy would be another factor, as well as any family history of depression or substance abuse. In addition, and we see this from the Youth Risk Behavior Survey, every 2 years it's administered both here and nationally. These results are consistent that students that identify themselves as having a different sexual orientation, or any students that are minority students, are at higher risk for a variety of health issues, including depression and suicidal behavior. Last but not least is stress. Our kids are under a lot of stress, more than we realize. It's important to not only teach them, but to model ourselves ways to reduce stress. We can't necessarily stop the things that are stressful for us, but believe it or not, there's a lot that we can do to reduce that experience of stress by learning things like relaxation techniques and other strategies. Let's go to the last slide. Finally, here are some imminent danger signs. Symptoms of depression. In other words, if you're seeing that, you want to have your child assessed, period. Talk about death and wanting to die, any kind of suicidal thoughts, plans, or fantasies, giving away personal possessions, telling a friend about suicidal plans, or writing a note. The other one that I would add is when someone who's depressed all of a sudden dramatically seems happy. Sometimes that's a function of them deciding that they're going to take their life, and it temporarily lifts some of those depressive symptoms. Now let's get back to our question. I'll read it again. My son smokes pot. He's lethargic and has little motivation and sleeps a lot. Is this depression, or is this marijuana use? Does marijuana use cause depression? Any other thoughts?
Go ahead now.
Marijuana by itself probably doesn't cause depression. But marijuana is well known to cause some lethargy and, lassitude and loss of ambition and things like that. That's not the same as depression. That doesn't mean that depression can't exist in someone who is smoking marijuana. And it also is true that marijuana frequently in kids who are in trouble leads to the dangerous use of other drugs. The critical thing is looking for significant and lasting signs of depression. If kids are underperforming in school, as can happen with marijuana, if they've lost interest, their behavior has changed, you want to get them to some help if you possibly can.
And believe it or not, there are some that do think that heavy marijuana use can actually cause some of the symptoms of depression. It's seen as kind of a negative cycle where, symptoms of depression can cause folks to self-medicate with marijuana, which again usually compounds the problem. And again, there are some reports that indicate that possibly heavy use of marijuana over a long period of time can start to induce some of those symptoms as well.
Usually when I see kids that smoke pot, I'll ask them how it makes them feel. Because for some kids, it is their way of medicating themselves. If you have a child who's very anxious, they'll actually use pot to relieve that anxiety. And So for some kids, that's where I think a medical evaluation would really be useful. A lot of kids I see that have ADHD, they get so hyped up during the day. If they're on medication, they smoke pot so they can sleep. We have a very strange relationship with pot in our culture, particularly in Boulder. It's very hard sometimes because a lot of parents actually smoke pot with their kids. So, but if your kid is getting up and smoking pot, I'd say that child's in trouble. If your kid is smoking pot just on the weekends, it's very different how your kid is using. And it depends on what the attitudes are toward the pot smoking. But I do know sometimes I have kids I see who actually won't take pharmaceuticals, but they use pot to help them with their anxiety, and it works very well. And,
Maybe we could talk briefly about that in terms of treatment
Right.
for depression. Generally speaking, there's three approaches, and Dr. Kleinman, feel free to chime in on this as well. Medication, antidepressant medication, psychotherapy, and often cognitive behavioral therapy seems to be primarily effective, but other therapy modalities can be effective as well, or a combination of the two. The other thing that we know from research is that exercise can help significantly with depression. In fact, just exercising vigorously 3 times a week for 30 minutes has been shown to be as effective, believe it or not, as antidepressant medication. And so I think part of it depends on the patient, their specific issues, the severity of the depression in terms of what combination of treatments might be most appropriate. But I defer to Dr. Kleinman for additional thoughts.
Yeah, exercise is very important, but it should be recognized that it's very hard to convince a very depressed person to engage in exercise because they just don't have the energy to do that. And so you may have to start with other measures if they're very significantly depressed. Medication for some kids, although not all kids, can play a significant role, and an accurate diagnosis is very important. Sometimes depression can be treated very nicely in a couple of weeks with an antidepressant medication. If it's depression because someone has manic depressive illness or bipolar disease, then medications also can be extremely effective in dealing with that. Faye said something that, in fact, made me smile because there are a lot of kids who would argue that since marijuana is effective at reducing their anxiety, that they should be referred to a medical marijuana clinic. And this is not my point of view. The trick is that often until kids can stop using the marijuana, it may be hard to engage them in other kinds of treatment that are more acceptable and reasonable. And that becomes a difficult problem. Teens frequently don't like to be told what to do.
Talking about medical marijuana, good segue for me, Dr. Kleinman. We're going to be presenting a talk here on March 5th, 7 to 8 p.m., on the impacts of medical marijuana. It should be a very dynamic conversation. I would really urge you to tune in. Next month, on February 6th, we're going to be talking about stress reduction, and our title is Address Stress Now. This would be a great opportunity, and we talked about it here in terms of depression. All of us could benefit from stress reduction. So tune in next month, February 6th, from 7 to 8 p.m., and learn about a variety of strategies that you can utilize yourself and with your family. There will also be a couple of free workshops coming up this month at the Meadows Branch Library. There's more information on all of our workshops and TV presentations on our website, boulderpsychologicalservices.com. On January 23rd, Dr. Elizabeth Olson will be discussing the teenage brain, which will be an opportunity to learn effective communication strategies and gain a better understanding of your teenager's developing mind. And on January 30th, we talked about it a little bit tonight, understanding self-harm in teens. Learn about this growing epidemic and how to stop the cycle of self-abuse with Susan Dennison and Jeffrey Kuhn. Again, more information about the location. These events are available on our website, boulderpsychologicalservices.com. I want to take a moment to thank our sponsors, without whose help these events would not be possible. the Boulder Counseling Cooperative, the Boulder County Healthy Youth Alliance, the Boulder Public Library Foundation, Boulder Valley School District, Centennial Peaks Hospital, the Parent Engagement Network, the Daily Camera, and our very own Hope Coalition. Thank you so much. Keep in mind that the three fantastic community resources that you've heard about tonight, Coleys Closet, the Hope Coalition, the Second Wind Fund of Boulder County, these are grassroots community efforts, people like yourself that have decided to step up and provide these incredibly needed services for our community. Consider getting involved. They could use your volunteer support. They could use your financial support as well. And in about a minute or two, we're going to put up on the screen contact information for these fantastic organizations. And you know, we also talked about the challenges of knowing what to do if you find someone experiencing depression. The Gatekeeper event, which I think is in March, is a wonderful opportunity, and that's exactly what the focus is. It's open to anyone, and it provides you, they actually role play and really give you skills that you leave with that will help you to know exactly what to do when you're in that kind of situation and how to effectively hand that off to a mental health professional. So consider attending that fantastic free event coming up in March.
But also
Kathy.
more recent, on January 26th, we certainly invite parents and youth to come to the Hope event at the First Presbyterian Church that we spoke about earlier. Same thing, warning signs, risk factors, what to do, what not to do, and stories of hope. And panelists talking about a variety of various, I'm not sure what the, okay, panelists as well.
It's a great event. It's an event that the Hope Coalition has been doing for many years. You will benefit from it if you're there. It's very powerful. Thursday, January 26th from 6:30 to 8:30 p.m. at the First Presbyterian Church in Boulder, 1820 15th Street. I want to thank our audience here tonight, our audience at home, and especially our fantastic panelists for joining us this evening about this very important topic. We'll look forward to seeing you again next time. Thanks for tuning in.
Now the planet's done its bowing down, and soon the growth returns to follow ground. But I know what's churning underneath the snow, and I love my baby, and we've miles to go. Hey, 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 I'm okay. Be with me. We'll beat this, can't you see? So wait a while, winter time. Wait a while, winter time.